Hi everyone, my name is Megan Brown and today we're going to be talking about lincosamides. There are 3 drugs in this category. There's clindamycin or cliamycin, lincomycin, and perlimycin. The action of this drug is that they prevent bacterial replication in a bacterial static mechanism by interfering with the synthesis of proteins. So it binds closely to the peptide transferase center on the 23S protein portion of the 50S subunit of bacterial ribosomes. So they're either bactericidal or bacteriostatic. These drugs are widely active against gram-positive bacteria in most anaerobes, but not gram-negative. So they also act against some mycoplasms and protozoas. They're mostly indicated for staph infections, particularly of bones, joints, and anaerobic infections. They're well absorbed following PO and IM administration, and they're widely distributed. They do not cross the blood-brain barrier. It does cross the placenta and can enter breast milk. It's metabolized by the liver and excreted in the urine and feces. Precautions for this medication would be pregnant women, any breastfeeding women, and in pediatric population. It is contraindicated in patients with a history of hypersensitivity to clindamycin or lincomycin, patients that have had ulcerative colitis or Clostridium difficile. Some adverse drug reactions include dizziness, headache, vertigo, arrhythmias, hypotension, diarrhea, Clostridium difficile, nausea, vomiting, abdominal pain, Stevens-Johnson syndrome, rashes, neutropenic, and thrombocytopenia. Topical administration of clindamycin can also induce contact dermatitis, dryness, burning, itching, scaliness, and peeling of the skin. Lincosamides can interact with anesthetic agents that produce neuromuscular effects, and rivampin can also decrease the effectiveness of this medication. Clinical use, they're most often used as an alternative antibiotic to patients who are allergic to penicillins. Other uses for lincosamide antibiotics are used for the treatment of dental infections, abdominal infections, abscesses, pelvic inflammatory disease, and anaerobic infections. Clindamycin is the most commonly used for treatments for acne, toxic shock syndrome, and malaria. It also decreases the risk of premature births in women with bacterial vaginosis. And they're also very successful in the treatment of MRSA. Rational drug selection, like I said earlier, the most commonly used lincosamide would be clindamycin due to its higher bioavailability, higher oral absorption, and efficiency with the target organisms. Monitoring. In these patients, you need to assess for infection. You want to obtain specimen for culture and sensitivity prior to starting antibiotic therapy, and they need to be monitoring for bowel elimination. So for diarrhea, cramping, any fever, bloody stools, and of course that foul-smelling C. diff smell that you can get from this medication. We also want to be looking for hypersensitivity reactions such as a rash and the urticaria of the skin. For patient administration, we need to make sure they take this medication with a full glass of water. It can be given with or without food, and they need to take it around the same time every day. They also need to be educated that they need to finish the entire bottle of medication in order for any antibiotic to be effective. Lifestyle management for patients, they also need to be educated that they need to be taking a probiotic with this medication since it can cause severe diarrhea and Clostridium difficile. My main takeaways would be the black box warning that lincosamides are very harsh on the GI tract. They can cause, like I've said over and over again, Clostridium difficile, so we need to make sure they have plenty of toilet paper, especially during this pandemic. Hopefully they have some. Also that clindamycin is the most commonly used medication, that patient education needs to be focused on monitoring for stool changes at home and for that foul-smelling diarrhea and for any hypersensitive reaction, as well as they need to be taking a probiotic with lincosamides. So I hope you all have learned something today. Thanks.